As Guyana continues its rapid development, access to quality healthcare remains a critical priority, particularly for residents in remote and underserved regions. For example, what is now a routine process of finding out a baby's gender would have been impossible in remote communities, but that's no longer the case.
I see it there. Do you see the scrotum? It's right here.
Okay.
Those two things right next to each other. It's a boy.
This is what's called Telemedicine, a project funded by the government to ensure that a slew of healthcare services can be provided to patients no matter where they live.
We did an assessment maybe about 3 years ago, and what we want to do at a health post or a health center is to deliver at least 115 different types of intervention. But we found that if we only have community health workers at this level, it's going to be very difficult for us to deliver these types of interventions. So one of the solutions is to use telemedicine, where if the healthcare worker on the site, if they have difficulty understanding the problems of the patient, they can connect using the telemedicine apparatus that we have given them, and they can connect with a doctor either at a regional facility or in Georgetown, and that person would be able to guide them.
So, how does it work? Community healthcare workers are provided with a health kit, which includes a laptop and advanced devices to allow for ultrasound and ECG. They also get special exam cameras. The government has partnered with Starlink for satellite internet service to ensure there's reliable internet connection. This allows effective WhatsApp, voice, and video communication. When a patient shows up at a health center and the community health worker is unable to diagnose, they can make contact with doctors. Take a look at this consultation between a community health worker at Guyana'S, one of the most remote villages in Guyana.
Have you done any scans before like this?
No, doc, this is my first time.
So that there's the fetus head. So there we see the baby's heart, we see the liver, right? And we see the spine on top. Let's see where the baby's head is now.
So yes, telemedicine ensures that distance no longer stands in the way of timely health care.
So for example, one of the very first sites that we opened was at Guyana'S, and that's right down at the bottom of Guyana. And to get there, you have to fly in. If you're sending out a patient and they have to come over land, they probably take, I don't know, a minimum of 5 days to get to Letem, and that's if everything is good. But if it's bad conditions, it probably take you 2 weeks. So they were a very isolated community, and they had all kinds of challenges. So by putting in telemedicine there, it made a big difference. And within the first months of putting in telemedicine there, we had a case of a child that had all kinds of complication. The healthcare worker on site was able to communicate that to GPHC. Because of that, we were able to send in a medevac to pick up that child, brought the child out to Georgetown. We treated the child, and the child went back. If that child had remained and they hadn't communicated, that child would have been dead. We had another case from Guyana'S where somebody had a hernia and it got infected. And again, if that person was not operated on in a timely manner, more than likely he would have been dead. So you have cases like this, and the telemedicine, because of the connections that we're making with Georgetown Hospital or one of the regional hospitals, we can actually diagnose in real time and make an effort to fix the problem.
Telemedicine services are being used at 53 health centers in regions 1, 7, 8, 9, and 10, with plans to ensure all remote health posts and centers use the technology by mid next year. Reporting for the newsroom, Neil Marks.